I'm at the annual meeting of the North American Menopause Society, and I'm speaking with...
Dr. Lisa Larkin.
And you are?
I am on the Board of Trustees of the North American Menopause Society, and I am founder and CEO of Ms. Medicine.
And she has a topic of interest to just about everyone, and that is, if you have hot flashes, what can you do other than take hormone therapy? So let me ask you, what are some of the ways that you talk to women about options that they can have?
Well, first of all, hormone therapy is the most effective treatment for what we call vasomotor symptoms or hot flashes. But there are many women who don't want to take or can't take hormone therapy. So there's two other buckets that I say that we have options. One are what we call non-hormonal pharmacologic medications, and then there's a class of what we call complementary and alternative medicine, CAM, and lifestyle modifications.
So there's prescriptions that just aren't hormones. What are some of the best ones among those?
Right, so the only one that's actually FDA approved specifically for treating hot flashes is a medication by the brand name of Brisdel, which is paroxetine. And it is in the class of medications called an SSRI. It's an antidepressant. It's used at low dose. And it does have data to support that it is effective with a very low side effect profile for treating hot flashes. And that's a very good option for many women, although
so it's not
everyone.
Really for depression here. It's
right. So we're using it at doses that are typically lower than doses we use for antidepressant effect.
And others that you...
Right, so there's many other in the same class, so serotonin reuptake inhibitors and NSRIs, so in the antidepressant class of medications, and we use many of them. Venlafaxine is another one that's very commonly used for hot flashes. There's also gabapentin, which is in a different class, and then occasionally people will use clonidine, which is a blood pressure medication for treating hot flashes. I will say that only paroxetine has the FDA approved indication for treating hot flashes. The others we use what's called off-label.
And for the ones that are not prescription, what options are there?
Right, so certainly there's some data to support what we call lifestyle modifications. So certainly hypnosis has been shown to be very, very effective. There's also relaxation techniques and other mind-body paced respirations and things that have some evidence, but hypnosis and cognitive behavioral therapy really has the best data around it. So weight loss, exercise has some mixed data, all healthy lifestyle habits I think we all encourage all of our patients to use, and again the data is a little bit mixed about the benefit for hot flashes. The other category that comes up is really this supplements, and there's a wide variety of supplements that are promoted to women in varying settings, either at the health food store or online or on social media as being effective for hot flashes. Really the data is not strong in support of any of these agents, and in fact the ones that are combinations of things that have what's called proprietary blends, you don't know exactly what's in them. Again, we just don't have a lot of data, and I think one of the key points, and I certainly have women who try these things and feel that they are beneficial, is that we have to remember that in all of the trials of hot flashes there's a very substantial placebo effect, and so really you can take jelly beans, and we know that in about 30% of women that will benefit hot flashes. And so again, what we really need before I personally will recommend a lot of these supplements is to have RCT data showing that they are safe and effective beyond placebo.
So everything works for somebody and nothing works for everybody.
Right.
Well, thank you very much.
Thank you.